All right. Hi there. My name is Jessie Poskochil, and I'm a genetic counselor at the University of Nebraska Medical Center. Today, I'll be talking about hereditary cancer and genetic testing for cancer syndromes. I have no financial disclosures, and my objectives for today include reviewing hereditary cancer statistics. We'll also learn how to identify individuals who are at increased risk for hereditary cancer based on their personal and/or their family history. I'll describe inheritance patterns for hereditary cancer syndromes, and then we'll discuss genetic testing for those syndromes and the implication of those test results. So to start off, we'll review some hereditary cancer statistics. Out of the billions of people in this world, 1 out of every 3 individuals will develop a cancer in their lifetime. That's kind of a high number. It might surprise some of you. Not all cancers are really aggressive. Some can be removed. Some are more aggressive than others. But most of the time, cancers are sporadic or random. They're not caused by an inherited genetic change. About 5 to 10% of the time, we do find a genetic change that really explains why someone has developed a cancer or why we're seeing that family history of cancer. That remaining 10 to 15% of all cancers is in the familial category. This is what we classify a cluster of cancers in a family. Maybe 3 people have breast cancer in a family, and maybe they've had genetic testing, but we haven't found any changes yet. But that's still more breast cancers in a family than we'd expect for the general population. And so maybe there are other risk factors at play, like they're a family with dense breasts, or they start menstruating earlier in life. Maybe they were all exposed to something in the area they lived. And so that's kind of what we call the familial group of cancers. For my presentation, I'll be focusing on that 5 to 10%, the inherited or hereditary cancers. So when we think about trying to identify someone who would be at an increased risk for a cancer, when I evaluate their personal and family history, I kind of look for these clues to hereditary cancer. These clues include cancer in 3 or more relatives on the same side of the family. So maybe you have a couple aunts and then a cousin on your mom's side that have breast cancer. That's a little bit more suspicious of a hereditary cancer syndrome than just sporadic. If you see anyone with an early age of diagnosis, like younger than 50, so the older we are, the more things we've been exposed to, it makes sense that there's an increased risk for cancer. But when you're seeing cancer at younger ages, we've been exposed to less things. There's less time for our cells to not work at, they're functioning still at what we expect. And so the earlier age is more suspicious. Cancer in multiple generations, like your grandparents, your parents and aunts and uncles, you and your siblings, and maybe even children, nieces and nephews. Seeing that kind of passed down fashion makes us really suspicious of a hereditary syndrome. Unusual or rare tumor types like pancreatic cancer, ovarian cancer, or male breast cancer are all rarer than some of those more common ones like female breast cancer or colon cancer. And so we really always want to see those types of individuals with those rare tumors and genetics. Someone who's had bilateral cancers, so maybe both breasts have had a cancer or both of their kidneys have a tumor. Someone with multiple primary tumors in their life. So someone who had a breast cancer and then maybe a uterine cancer later on, even if they were at older ages. Cancer in the absence of an environmental factor. So for example, we know that lung cancer can be really linked to smoking. And so if someone does not have a history of smoking or secondhand smoke and they have a lung cancer, just makes us more suspicious as to why did they get that? Were they born with something that increased the risk for that type of cancer? And lastly, specific pathology of a tumor. So for example, triple negative breast cancer. This is just referring to kind of those hormone receptors. And it's a specific type of breast cancer that just makes us more suspicious. So these are just some of the things I look for in a family or an individual when I'm suspecting hereditary cancer syndrome. If you have some of these features, it doesn't mean you do have a hereditary cancer syndrome. It just might be good for you to get evaluated by a genetic counselor so we can see if testing would be recommended. So now that we've talked about some of those clues to hereditary cancer, let's talk about how it's inherited. Before we go through inheritance patterns, I'll review what a gene is. So our body's made up of billions of cells, and within those cells contain all of our DNA. Our DNA is like the instruction manual for the body. It tells our cells how to function, how to work with each other, and small portions of DNA are called genes. Our genes are made up of letters, so it's kind of like letters in a word in the instruction manual. And testing for hereditary cancer syndromes looks at these letters and spell checks them to see if they're the letter that we expect to see. Now, sometimes we find a spelling change, like maybe a G instead of an A. And that one letter change is enough to make that gene not function like we'd expect. So maybe the protein can't be produced, maybe it's just produced in lower amounts, maybe it's just not working at all. And so that's kind of what this testing looks for, and how some of these hereditary cancer syndromes can arise is if there's a spelling change. So most of the time, individuals only need one copy of their 2 copies of genes to have a spelling change to see an increased risk for cancer. This is what we call an autosomal dominant inheritance pattern. So in this diagram, we have 2 individuals at the top with both of their copies of one gene. So we get 1 copy of a gene from mom and 1 copy from dad. And so one parent has 2 working copies. They're spelled like we expect, and so they're protecting us from cancer. The other parent has 1 copy not working and 1 copy working. And so the 1 copy that's not working maybe has a spelling change, maybe it has a piece missing, but that's enough to see an increased risk for cancer in that individual. Now, this individual was born with this change. So it's not something they inherited later in life. It was something they were born with. They can't change it, and they don't get to choose if they pass it on. So we know that there's a 50% chance to pass on either that working copy of the gene or the non-working copy of the gene to each of their children. And most of these changes aren't new in someone, and so we suspect that their siblings would also be at a 50% chance to have the same change, and one of their parents probably had it too. And so when someone is found to have one of these changes, we like to test all of those first-degree relatives to see who else has this change. So this is what most cancer syndromes are inherited as, where you only need 1 copy not working to see that increased risk. Some cancer syndromes are inherited in an autosomal recessive inheritance pattern, where if 1 copy of the gene is not working or misspelled, you still have 1 copy that's working, and that's enough to not have an increased risk for cancer. So we call those individuals carriers of a genetic change because they're not really expressing that symptom or any features of that increased risk for cancer, but they can pass it on. And if someone inherits both copies that are not working, then they do have this cancer condition. So in this diagram, we have both parents that have 1 working copy of the gene and 1 non-working copy of the gene. They aren't at an increased risk to develop a cancer, but they do have a 50% chance to pass on that non-working copy, just like with the previous inheritance pattern, but only a 25% chance for a child to have the condition, because again, you need both copies not working to see that increased risk. So this is a lot rarer for our cancer syndromes, but it is an inheritance pattern that we do see. So now that we've talked about the inheritance patterns for cancer syndromes, let's talk about some of our most common hereditary cancer syndromes. A lot of times we think of hereditary breast and ovarian cancer related to the BRCA1 and BRCA2 genes. You may have heard about these genes before. They're some of the most well-known and well-studied genes, and we've known about them for quite a while. 10 years ago, this is what we thought made up most of our breast and ovarian cancer cases. And still today, they make up a majority of hereditary breast and ovarian cancer. And with hereditary colon cancer, we think of the Lynch syndrome genes named after Dr. Henry Lynch, MLH1, MSH2, MSH6, PMS2, and EpCAM. So those are common genes that we always test in someone who we suspect has hereditary colon cancer. But it's good to know that these are not the only genes connected to these cancer syndromes. In the past decade, we have learned about many more genes associated with hereditary breast and ovarian cancer, or hereditary colon cancer. We even know genes that are connected to hereditary kidney cancer or hereditary skin cancer. And so we're always learning more, which is great. And so some people who maybe had testing for BRCA1 and 2, 10 years ago, didn't find any changes, so they were negative. Maybe they suspected that they didn't have a hereditary cancer syndrome, but in fact, they had a change in one of these other genes like ATM or CHEK2 that really does explain their cancer. We just didn't know about it or weren't able to test for it at the time. And so it's good to know that there are more genes out there, and we're always learning more. So finally, we'll kind of focus on the genetic testing aspect of meeting with a genetic counselor. So for cancer genetic testing, we really do a panel of genes or a group of genes related to the cancers we're seeing in you and your family. So maybe someone in your family had breast cancer, and so we want to test those breast cancer genes, not just BRCA1 and 2, but those other ones in that list. But maybe then someone on dad's side had colon cancer at a young age, and so now we want to include colon cancer genes too. So we can really curate a panel that fits your family history and your personal history so that we can kind of cast the widest net to see if there are any changes. So when we test a panel of genes, we can get 3 different results. One being negative, we didn't find any changes in the genes we were looking at. This means that maybe your cancer in you or your family is one of those sporadic cancers, not being caused by an inherited gene change. Maybe you're negative for a change that someone else in the family had, or maybe we just don't know about the gene yet to test for you. And so we suspect that it's sporadic or environmental, but we're not sure yet. So with a negative result, we don't expect you to be at an increased genetic or hereditary risk for cancer. So we kind of keep following you based on your personal and family history, keep doing those general population screening recommendations. And then we really don't need to test other family members that haven't had a cancer. So if you're negative, we didn't find anything in you, you couldn't have passed something harmful on. And so we wouldn't need to test your kiddos if you're negative. Now, on the other hand, a positive result means that we did find a change in one of those genes we were looking at. With a positive result, we might recommend different management for you. And so, we might recommend surgical options or different treatment for a current cancer. If you do not have cancer, we might recommend increased or earlier screenings in the general population. So maybe you have a gene that increases the risk for colon cancer. And so now we recommend doing colonoscopies every 1 to 2 years instead of every 5 to 10 years. With the positive change as well, we also want to test all those first degree relatives, because again, most of the time this isn't new in someone, it's being passed down. And so we want to test parents, siblings, and adult children. Now, there's one possible result that's kind of in between negative and positive, and this is called an uncertain result. So this is when we do find a change in a gene that we're looking at, but we don't know if that change is harmful or if it's just one of those benign changes that makes us unique and the gene can still function like we'd expect. So sometimes with an uncertain, we just need to do a little more research before we can definitively say, no, this isn't harmful, or yeah, we do think this is going to increase your cancer risk. When someone gets an uncertain result, we kind of keep following them just based on their personal and family history. We don't have enough evidence to say you need to do colonoscopies every 1 to 2 years, or you need to remove your ovaries for an ovarian cancer risk. We just kind of keep following them as we typically would. And then over time, as we get more information about that change, we'll be able to get it reclassified to either positive, harmful, or negative, not harmful. Now, with testing, we're always learning more. And so kind of like I alluded to earlier is, 10 years ago, we really only thought about BRCA1 and 2 being connected to breast and ovarian cancer. But now we know there are more genes. And so sometimes if someone had testing in the past that was negative, it doesn't always mean that you're negative. And so, we might learn about more genes that are connected to a cancer that we didn't know of before, and we want to do testing there. Maybe your family history is updated with more types of cancers. So maybe 10 years ago, we thought, we only saw a couple people with breast cancer in the family. So we only tested breast cancer genes. Well, now, cousin Eddie developed a colon cancer and, Aunt Regina developed a pancreatic cancer. And so now we want to test those colon and pancreatic cancer genes. So updating your family history and keeping your genetic counselor and doctors informed can help us make sure we're keeping you updated with the most comprehensive testing. Also, genes can be analyzed with different technology. So some testing techniques spell check the gene, seeing if there are letters that are different than others. Some technology looks to see if there are missing or extra pieces of the gene. So missing would be deletions of the gene and extra pieces would be duplications. And so, testing technology improves over time. And so sometimes we can't always see the full picture. And so updated testing might be helpful if we have new techniques out. So I hope that gave an overview of kind of what it's like, to visit with a genetic counselor, what we talk about, updated testing, maybe if you haven't thought about that, and then just some of those facts about hereditary cancer. So if you have any other questions, I'll be happy to take them during the Q&A session, or you can email me or call me with my information there. And thank you so much for your time and for your attention today.